for coming today for our first of 4 public forums regarding the changes that are going to happen in adult services. My name is Megan Manuel. I'm the superintendent here at the Warren County Board of Developmental Disabilities. I just wanted to introduce you to a couple of our other directors who are here, because in case you have any questions, you can always ask me, but feel free to contact any of them as well. I'll start up here with Carol Heil as our Community Resource Director. Tony Heide is our Service and Support Administration Director. Michelle Swearingen is our Business Services Director. Chris Smith is our Support Services Director. Heather Moore is our Adult Services Director. And Pete Mason was running around in the back as our Operations Director, kind of helping with our technical difficulties this morning. So feel free, if you have any questions, to contact any of us. We'll be glad to get answers to your questions at any time. What I have today is kind of a set presentation that I'm going to kind of go through some things. At any time, if you have any questions, please feel free to ask. We'll also allow time at the end for any questions if they come up. We'll be happy to answer any that we can. So we'll kind of get started. This is a little bit about what we're going to talk about today, the changes that we're facing, so that you are aware of why we are faced with this change. The options that are available to us for those changes, and then the option that we selected based off of those options. What does this mean? Kind of a little bit of an explanation of what that change will do. And then the timeline established as far as some of the things that we need to do and when we're going to hope to accomplish those. How will this affect me and my family, or you and your family? And then a little bit of information just for your knowledge about the statewide status by counties and what are the other counties specifically in our region doing, and then again we'll open it up for questions. So I'll start with the changes that we're facing. The Centers for Medicare and Medicaid Services, or CMS, came out with a new regulation in March of 2014. And CMS is the federal arm of the government, the arm of the federal government that oversees Medicaid, which is a big part of the funding for us here at the Warren County Board of DD. And what they said was that entities that are providing case management or service coordination could not also provide direct Medicaid waiver services. So the services that we provide through your service coordinator, writing the plan, making sure things are compliant, we couldn't provide that service and also provide the direct service, which would be the adult day services or transportation. So they're saying that that's a conflict of interest to provide both. And this does apply to all 50 states in the United States and all 88 counties in Ohio, not just Warren. So that's a part of the federal government that then went down to all 50 states. Initially, when this came out, the state of Ohio asked the federal government, could we grandfather the people that are currently being served? The way it's working now is working, we want to keep it that way. Can we grandfather in? And any new people coming in, we would enforce this new regulation. CMS said no. They rejected that proposal and said, you need to do this for new people as well as current people. So in December of 2014, CMS requested that Ohio submit a corrective action plan to show how we were going to come into compliance with this new regulation. So the corrective action plan, this is what Ohio sent to CMS, that said that county boards of DD would be prohibited from providing both the case management or service coordination and the direct Medicaid waiver services as of 2024, unless no other options were available. So when CMS initially put out this regulation, they said that all 50 states needed to be in compliance by 2019. When Ohio sent back their report, they said there is no way that we will have all 88 county boards in compliance by 2019. And to put that in a plan that says we will would not be truthful, because there's too many people that we serve and there's too many services that are being provided through the county that there's no way we could become compliant by 2019. So when they submitted this corrective action plan, they put 2024 as the date, hoping that the CMS would approve it. So the county boards who are providing both the services, both the direct service piece through the adult services and or transportation, and the case management or service coordination, would need to submit a benchmark plan on how we were going to reduce the number of people we served, and how then we would eventually discontinue the services altogether by 2024, discontinue the county providing that service. County boards would need to be providing no more than 30% of the statewide direct Medicaid waiver services by March 2020. So in addition to providing 0 by 2024, we needed to show progress on how we were reducing the number of people we served so that by 2020, March of 2020, it was no more than 30% statewide. They also put in there that county boards must work to recruit sufficient providers so that individuals had options other than the county board. So CMS approved Ohio's corrective action plan and said they did give us until 2024, which was a big feat because I don't think there were any other states that received that. I went to a regional meeting in Chicago last summer, and there were several states, Minnesota, Michigan, Illinois, Indiana, Iowa, were all there, and they didn't even think to ask for an extension. So when Ohio presented their plan and said, we asked till 2024, they said, well, we didn't even think of that. We should have done that. So we were pretty fortunate to be able to get to 2024 as that date. In their approval, CMS also acknowledged that Ohio has voluntarily made significant progress in this area over the last 7 years by recruiting additional private providers. Some of you may be familiar with, we do have over 20 private day providers already. So that was something that Ohio had made progress on, and CMS acknowledged that. And that sufficient provider capacity does not currently exist in all areas. So they were aware that we couldn't just flip the switch and hope that all the private providers could take over the services that county boards are currently providing, because that capacity wasn't there. We needed to build towards that. So some information on what Warren County sent as their benchmark plan. We submitted it to the Ohio Department of Developmental Disabilities by the deadline of October 1st of last year. We included a goal to reduce the number of individuals served by Warren County in both day services and transportation, and also included a goal that we were required to have to develop new and then increase capacity of current providers. So we have a committee of people who are working with private providers, many of whom I already introduced. Tony and Carol, Heather are on that committee, to try to work with other providers to see what is it that they need to be able to either increase capacity or to move into Warren County to be an option for people. They did approve our plan on November 19th, and then all county boards are required to provide a progress report to DOT twice a year, so we'll have to do that probably coming up in June or July of this year. So what options were available to us? When we were looking at what we could do as far as coming into compliance with this, we figured that we were faced with 3 different options. Those options were either to, 1, privatize Production Services Unlimited. Production Services Unlimited Incorporated already exists, so there's a relationship that's built there already, so we could privatize them to try to make changes as little as possible for people. We could dissolve PSU and find other private providers for everyone currently being served by PSU. So we would just basically close the doors, work with families to find providers outside of PSU to provide those day services. Or have another provider just come in and take over PSU. So another provider could kind of buy the rights and come in and provide the services. So the option that we selected. We thoroughly vetted all 3 options, looked at the pros and cons of all of them, and decided that the best option for us, for the people served, for family members, employees, and the community, was to keep PSU open and to privatize it. So we felt that that would be the best thing for the people that we serve specifically, to keep that location open and to continue to provide those services and just change the administrative piece of how that operates. So we did set an effective date of January 1st of 2018 for that. So what does this mean? Employees who are currently employees of Warren County Board of DD will become employees of PSU Incorporated. So the employees that are working daily at PSU who are currently county employees will transfer over and become employees of PSU Incorporated. We will work with PSU to get them established as an independent company. They already are incorporated. They already have a board of directors, but there's still some things that need to be put into place for them to actually be a separate functioning company. So individuals served will still have the same staff and be located in the same building. We hope that all the staff that are currently county employees, the plan is to just shift them over to PSU. So although it may not be the same staff person in the same group, it'll be the same people that you're seeing every day that will be providing the services to the individuals at PSU. So the timeline established, we kind of put together a list of things that need to be accomplished between now and January 1st of 2018. And the checklist included a timeline for completion of each of those items. So just kind of want to go through some of the things that we put on there and what the deadline was for those, starting with a couple of things in 2015 that have already happened. We did do a formal vote by the PSU Incorporated Board to move forward with privatization. We explained to them the options the same way I explained them to you, and told them that this wasn't going to be an easy process, but it was going to be something that we felt, like I said, was best for the individuals served and their families, and the PSU Incorporated Board agreed. They feel very strongly that the services that are provided at PSU are important to people in Warren County community and wanted to move forward with that privatization process. They felt it was very important to keep it open as an option for people. We also met with employees regarding the decision so that the people at adult services or at PSU would know what does this mean for them in their employment. We kind of laid out everything again that I told you today so that they're aware of what that means to them, and we continue to meet with them every month. So we hold 2 meetings a month to give them updates on where we are with the progress, give them an opportunity to ask questions if they have any, and try to get answers to them as to what's happening as we go along. More questions kind of come up, and so some of them we have answers to, and some we're like, oh, that's a good question, we'll have to get back to you on that. But it's basically getting the conversation going so we at least have face-to-face conversations with them once a month. In 2016, some of the items that we have for this year, meet with county officials to provide information about privatization. We've done that. We met with the Warren County Commissioners, the Warren County Auditor, the Warren County Prosecutor, and the Warren County Probate Judge, kind of explain to them once again why we're faced with these changes, why we have to do them. This is not something we want to do, but it's something that the federal government's requiring us to do. So we met with them, explained it to them in case they got any questions from their constituents, they would kind of know what was going on. Hold public forums to inform stakeholders about privatization. That's why we're here today. This is the first of 4 I mentioned. So we'll be providing information about this to people and answering questions that any of you may have. Some of the other things this year that needs to be done, hire a CEO for PSU. So PSU would need to hire a CEO as a private entity. They would need to have a CEO in place to operate and be able to become a Medicaid provider. The CEO is the first item on that checklist in order to be certified, is to have a CEO in place. So that will be something we'll be working towards this year. Contact the Ohio Public Employee Retirement System regarding the process for carryover employees. I mentioned that the intent is for all the employees who are at PSU to stay at PSU and become employees of PSU. One of the benefits that they are entitled to as a carryover employee is to maintain their PERS retirement. That's an option for them. They don't have to do that, but if they're vested in PERS and want to stay in that retirement system, they will be able to select that as an option. So we have to contact PERS regarding all the things that we need to do to make sure that that's an option for our employees. And develop a business plan for PSU Incorporated. As a separate entity, this kind of shifts what their goal is as far as making sure they're sustainable as a private entity. Obviously, they won't have the safeguard of the Warren County Board of DD as much as they do now. So we want to make sure that we set them up so that when they're functioning as a separate entity, that they'll be sustainable. And then some things for 2017, I mentioned that PSU would need to apply to be a Medicaid provider. Right now, the Warren County Board of DD is billing Medicaid for those services. Once they become a separate entity, PSU will be billing for those services, so they would need to be certified. We need to establish policies, job descriptions, table of organization, and salary schedules for PSU Incorporated, so that will be a whole new structure as well for them to set up since they're going to be taking over the employees that are currently county employees. Hire a business manager for PSU Incorporated. Clearly I mentioned we want to make sure they're sustainable, so they need to have good financial policies, a good financial person in place to to complete the billing, to do the budgeting, that kind of stuff, so that they can make sure that they're sustainable. We'll be meeting with employees again regarding the transition to PSU, specifically about their vacation payout, retirement, health insurance, those kinds of things. We need to make sure we get those in place, so once they become a separate entity, that they can have all those benefits in place when they become an employee of PSU. Develop the contract between Warren County Board and PSU Incorporated. We need to work out the details of what that will look like as a separate entity. Individual service plans will need to be revised to show PSU Incorporated as the provider. Right now, the services are provided at PSU, but technically Warren County Board of DD is the provider. So we'll need to make sure those are changed, and I know Tony and his staff will be on that. And then PSU Incorporated will complete the new and transfer employee orientation. So as employees come on, one of the Medicaid requirements too is that the employees that are providing the services have that orientation and that initial training. So how will this affect me and my family? Simply, hopefully it won't. Our goal is to complete this process in a way that it won't have any negative effects on the people that we serve and their families. Individuals will still be coming to the same building and will be seeing the same staff every day. Changes will be behind the scenes and administrative, so it'll be working with us as the management team and the staff as transfer employees, but hopefully the services that are provided will be maintained and there won't be any difference for the people that we serve. That was one of the biggest reasons why we decided to go down this path. Someone said that this was the path of least resistance, and we kind of said, no, it would have been a lot easier to say, hey, we can't do this anymore, we're gonna close the doors and we'll find you other providers. But we really truly felt that that was not the best thing for the people that we serve. We have people who have been going to PSU for years. They are safe there, they're comfortable there, and so we're willing to go down this path and do this extra work to make sure that that's maintained for the people that we serve. That was the most important thing for us. I know this is hard to read, but you can kind of see by the colors. Just wanted to kind of give you a view of statewide what different counties are doing. The red counties, as you can see, are already privatized, so we are not the first people to be going down this path. There's several counties who are already under the private system, and it seems to be working. The green are in process, and then the purple are in discussion, and then the blue are county board operated. So you can see there's several red, specifically mentioning kind of the southwest corner down here. Claremont, Brown, and Clinton are already privatized, so we have some neighbors who've already gone through this process who we're trying to learn from and get information from so that we are doing things the right way, which is also why we set a timeline of January 1st, 2018. Some people thought that might have been a long time, but we really want to make sure we're very thorough with this and that we're doing things the right way. Butler County recently decided that they were going to go down the path of just closing their doors. They have decided not to privatize. They are going to be closed as of March of 2017. So I know they're in the process now of finding other providers for the individuals that are currently being served at their day program. So that's just kind of a snapshot. Hamilton and Montgomery specifically, they're both in blue. It says county board operated. Obviously they're the two biggest counties in our region and have a lot more people to be concerned about. So they're still trying to figure out what they're going to do, what's the best thing. They have more than one. We just have PSU, but I know Hamilton and Montgomery both have, I think, close to 5 different sites where they operate. So it's a bigger process for them. And that's kind of the synopsis of what we have for our presentation today. I'm going to open it up for questions if anybody has any. And again, I have my wonderful management team here who can assist with questions as well if you have specific questions that apply to their division. So I'm going to open it up for questions now. Does anybody have any questions?
Financially, how does the PSU board, how did you financially afford to purchase the facility and privatize it? I don't know how that works.
Question is about the financial ability for PSU to privatize, including the building. That's one of the things that we have ongoing conversations about, and I mentioned that one of the important things is for us to make sure that it's sustainable, that PSU can operate through their Medicaid billing and their contracts. So that's an excellent question. One of the things that came up, obviously the PSU building right now is owned by the county, so we own it. So we are trying to figure out, are we going to sell the building? Are we going to lease it to them? How is that going to work as far as making sure that they can financially sustain themselves and that, you know, we're covering all our bases as far as the building and the equipment inside. So that's part of our checklist as far as figuring out what we're going to do. We do have a meeting set up next week with the Warren County Auditor, myself and Michelle, regarding the financial and what that means moving forward, so that they can continue to operate and make sure they stay afloat. So, good question.
Is PSU Incorporated nonprofit?
It is. PSU Incorporated is a nonprofit, yes. And the intent right now, obviously the board of directors will need to decide how they want to move forward as an entity. At this point in time, we have no reason to think they would want to change that. I don't think their goal is to be some big money maker. Their goal is to provide quality services to people with disabilities. So as long as they are in the, you know, making enough money to sustain themselves, that's their concern. They don't want to be rich or whatever. So yeah, as far as we know right now, the plan is to continue to stay a nonprofit and just to continue to provide the services. Yes?
How does this affect the transportation service?
Oh, good question. Transportation is one of the ones that also will need to, the county board will need to get out of that business as far as the federal government's concerned. Right now, we provide services to about 40 people through the Warren County Transit contract. So even though we're not the ones providing the service, we're the ones billing Medicaid. So from the federal government's perspective, we're the provider of record, which means to them, we're the provider. So we are working with the transportation, the SSAs, and the transportation division or transportation contract to kind of figure out, will they become a Medicaid provider? Because if they become a Medicaid provider, things could stay status quo. They would just be the biller of Medicaid instead of us. Or if that's not something they want to do, we're trying to figure out how we can assist them to make sure that we're as least disruptive as possible again, and that those 40 people won't have to find new providers. But that's part of our conversation as well, is to work with them to see, you know, can we assist you in becoming a Medicaid provider so that you can continue to provide this service and bill Medicaid.
As service coordinators, are we supposed to be helping people explore other options if they're attending PSU right now, like the 30%?
Yeah, good question. I actually was in a meeting last week with a couple people from the state, and I asked that question because when we submitted our benchmark plan, we had some requirements to downsize PSU, and we put in there that said, this was before we voted to privatize, and said, if PSU decides to privatize, these numbers could change. Because if PSU is a separate entity and we have to downsize, technically we're taking quote-unquote business, I mean, if you're talking about from that perspective, away from PSU, who's going to become a private provider. So what they told us was, you can't just say, oh, we voted to privatize, so we're done. We still need to provide options. And I said to them, well, we are. We're still working with the providers to expand their services, to continue to provide options. So we need to still, every year, like you normally do, say these are the options. But if they're at PSU and they want to stay at PSU, then that's fine.
You as a taxpayer, is that still going to go strictly to Warren County?
Yes, good question. Right now, the way that the Medicaid works is the federal government pays approximately 60% of the cost for the services, and the Warren County Board of DD pays the other 40% through our levy funds. If PSU is privatized, we'll still be required to pay that 40%. It just, instead of coming to us and keep staying with us to provide the service, we will then pay it to PSU. So the levy funds will still come to us to provide that service. We'll just be paying it out to PSU instead of keeping it to provide the services ourselves. Does that make sense? Okay. So yes, we'll still be receiving the levy money and it'll still be providing the service. It'll just be going to PSU because right now we're required to pay the approximately 40% match to cover that services. PSU would not be required as a private entity to pay that. The county board would still be required. And we do that for the other private providers. I mentioned that there were 20 some providers. Right now, if an individual goes to another service, another service provider, they bill the Medicaid for the 60% and the Warren County Board is paying 40%. So that will still happen. Yes, good question. Ron?
Megan, for those who are not on a Medicaid waiver and they have our county services now, well, how will this affect them?
This is a requirement from the federal government for people who are on Medicaid. So currently, if they're not on a waiver or are either aren't eligible for waiver or on a waiver for some reason, then the county, I mentioned that we would need to have a contract with PSU for different things. That would be one of the things that would need to be in the contract. We're still, as the county board, we're still required to provide that service. So we would need to contract directly with PSU to provide that service, and until they're on a waiver at 100% cost for us. So they would still be able to get services. It would just be, the finances would be a little different, but they would still get services from PSU.
Okay. So if you're a payer of last resort, that's still in play?
Correct,
Okay.
yes.
Thank you.
Mhm.
Will your admission or hiring practices change once you privatize? I know currently, a person graduating from the public school system cannot enter PSU. How will there be outside persons coming in? How is your admission set up?
As far as the individuals being served, well, the requirements for people who are eligible for adult services, they have to be graduated from high school. Is that it? Is there an age limit? I can't
They
remember.
lowered the age limit, it used to be 21.
And now it's
Now
18. Okay, yeah. So they would still need to be graduated from school to be able to get the service, but that eligibility requirement will still be the same, because it's part of the Medicaid requirement in order to bill the adult service waiver service. They would need to be graduated, so they would still need to do that if they were going to a private provider.
Would these be persons graduating from the inclusion classrooms or anyone graduating from?
They would just have to graduate from a school district. So whether it be an inclusion class or a special ed class or whatever it may be, they need to get their certificate of completion from the school district. And then they could be eligible for adult services. And that's whether PSU is private or still part of the county board. So it would be the same.
Do you anticipate that the nursing staff will still be included once privatized? I know some private ones out there. I need one for my daughter specifically, and they did not have
Sure,
nursing
sure.
staff, some of them.
Yes, that's come up quite a bit, honestly, because nursing is not included in the Medicaid rate. So that's something that's provided outside of that. We're very much aware that there are a lot of people at PSU because we have nurses that other people don't. So our intent is to maintain that service. That will be part of our contract with PSU as well, is that we know that there will be people who will need nursing and will need to have nurses there. So we will contract with PSU to continue to provide that nursing, because that will be a necessary service. Yes. Anything else?
Yes, the question that was asked before, you didn't quite get answered.
Okay.
To our understanding. What she wants to know is, can non-disabled individuals come to PSU when they're privatized? Will it be open to individuals that do not have disabilities?
To get services?
Or to work?
To work, absolutely, yeah. There will be an opportunity for people, PSU will still be hiring staff, if staff leave and they need positions, they'll still be doing that.
In production.
Oh, okay. That's not something that we've determined yet, so I apologize I didn't answer your question, Marilyn, but that's something that we'll be working out through with PSU. I mentioned that they were going to do a business plan, so that will be included as part of how they want to operate once they're private, and who they want to provide services to, whether it be solely people with disabilities. One of the other requirements that we have as a state is that we need to start providing more services that are community integrated. So we need to provide options for people out in the community, not just employment, but in other ways. So that will also be part of their business plan, is to develop those kinds of services. And I know that's something that Heather and Mary have been working on already, but something that it will be part of the business plan as to how we're going to meet that federal requirement as well, to show that we're not segregating people 8 hours a day or 6 hours a day in a workshop with no one else around them. So bringing in people who who don't have disabilities could be an option as well. Sure.
Another question, when an individual is going to PSU, totally going to PSU, they want to try other, day programs. If they leave PSU and go to another day program and that does not work, can they come back to PSU before privatization?
Before privatization? Are they leaving and going 5 days a week?
No.
No. Then yes. This is one of those things that we've asked the state. Honestly, it's one of those things that obviously we want to do what's best for individuals, but what we don't want to do is provide them the option and say, oh, you tried it, so you can't come back. So we've got to work with families to be able, and we've expressed that to the state to say, we can't just say, hey, you're finally going to try something, and if it doesn't work, then too bad, you can't come back. So we'd have to work with the state on those situations. Do you have any, Heather, you want to add something?
Yeah, what we've been doing is working with the teams to establish kind of a transition period where we have not exited that person from our system yet. Usually it's been 30 to 60 days, depending upon the individual. That really determines, luckily we know the individual well, we work with the team. If it might take a little bit longer, then we work through that. It is a problem once someone exits to be able to do an intake to bring the person back in legally, but, we're not doing anything excessive, but we are giving legitimate time for folks to try something different, make sure it works. We don't want anyone to end up in a bad situation. So.
Everyone hear that?
Do I understand it correctly that there is currently a freeze on accepting new clients in the PSU because I know Brenda was looking for
Right.
a daughter?
Correct. That's one of the requirements that the state put in place when they sent their corrective action plan, is that in addition to us having to downsize, we had to what they call close the front door on July 1st of last year. So we are not allowed to, what they're saying is if there's a conflict of interest, you can't start building up your census as far as the number of people who are coming to the county board operated. So that's another benefit. I mentioned that we have till 2024, but we're privatizing as of 2018. That's for instances like that, because once they're private, they can't accept new people. They can, yeah, because there'll be a separate entity. It won't be a county board-run program. Right now, if it's a county board-run program, we're not allowed to accept new people. So, yeah.
And just to add to that, if there's no other willing or able provider, then we can accept.
Yeah, the state also said if there's no other willing or able provider to serve the person, then PSU could accept them as a county board operated, but they're very strict from the state perspective as to what that means as far as willing and able provider. If the provider says, yes, we'll provide the service, but you as an individual or as a family member says, I don't want them to go there, the state, this is not Warren County Board of Duty, the state says you can't go to PSU because there's a willing and able provider. So we've got to be able to work with the families on what that means and getting them comfortable. We have, like I said, 20-some options here in Warren County, so if they have new ones or a new person coming in, then we work with them to visit, to kind of talk to them, to kind of learn, because the state's perspective of what willing and able means is a very small amount of leeway. Yes.
We're looking for people that are going to run PSU Incorporated. Are they mostly coming from the county?
Well, that will be up to the board, as the PSU Incorporated board. So they will be the ones hiring the CEO. Clearly, it makes sense for them to have people who are either familiar with us, familiar with DD, and there are some requirements as far as to be a CEO. You have to have a certain number of years of experience to be a CEO of a Medicaid provider agency. So it could be someone from the county. Like I said, we'll work with the PSU Incorporated board. We'll provide as much feedback to them as they want. We've said to them, we will be there as much or as little as you want. We don't want you to think we're micromanaging the process, but we don't want you to think we're leaving you high and dry. We'll be as involved as you want to be, which includes the hiring, setting up policies, procedures, all of that kind of stuff. We'll be right there with them. So it'll be someone who has experience, because it has to be, whether that be in Warren County or other agencies, we don't know. But yeah, we're hopeful that PSU will assist them in hopefully selecting the best person for the job.
You might not have this answer yet, Megan, because it's kind of already asked, but I think with the families I work, that's their biggest concern is when they go before privatization, after, is if we're allowing just anyone to come in and work, whether it be health needs or whatnot, I think that's their biggest fear. So with that, does community outings kind of count as that community integration piece? I'm asking that, right?
No, it's a good question, but unfortunately, I don't have a real good answer for you because we've asked repeatedly, what does community integration mean?
Right.
Like, give us a definition, and the state said, we don't have a definition. And some people think we don't necessarily want them to give us a very specific definition because then it'll be harder to follow. So we're kind of expected to define what community integration means. They have said it's not just, oh, I go out on an outing once a week, that's community integration. That they won't accept what we've always done as far as that goes. But what it really is, we're kind of left on our own to define. So.
I have to go back to the reduction of 30%.
Okay.
I missed how will you determine that? Is that determined by you or once it's private? You have to have it reduced?
The 30% number is what the state has said they will be down to by March of 2020 statewide. And that's for county board operated. So by January 1st of 2018, we will be privatized, so technically we'll be at 0. So we'll meet the 30% and beyond because that's just how many people statewide will still be served by county board operated programs.
I thought it was participants.
No, it's just how many people are served by county board operated programs. By March of 2020, statewide it needs to be 30% or less. So in Warren County we'll be fine because we'll be privatized by January 1st of 2018. Yeah. Sure, okay.
I know so many, and you're posting now for people
Uh-huh.
to meet PSU. And you say 18. For the staff coming in to place people that are going to Warren County, are they being trained?
The direct care staff that we're hiring at PSU, oh yes, they're still going through the same requirements that all of our other staff are, because they are being hired in as Warren County employees. None of the employees will transfer till January 1st of 2018. So they're still required to go through all the same training, all the same hiring process, the background check, the drug test, all that stuff is still happening for the people that we're hiring right now, yes.
And when PSU becomes their own,
Yes.
will they do background checks and all that?
Yes, they'll still be doing background checks to make sure that because there are some requirements as far as who can and cannot work with people with disabilities, and if you have a background check with certain offenses on it, we can't hire you. PSU will still be doing that.
I don't blame the employees for going to Warren County to work
Right.
because of perks.
Right.
But, it, just presents a problem with new people coming.
Yeah, understood. And I mentioned Butler County decided that they were going to close their doors in March of 2017. They've had a rush of employees leave for that very reason because they're trying to be the first to find either with school districts or the county or somewhat. So it is a benefit that people will be able to when they transfer as a carryover employee, they'll be able to stay in PRS, but
But how would they do that, Megan? I'm talking about the people that touch our kids.
right.
The ASPs, I think they call them. They're the lowest pay, in my opinion, and then, you're gonna have locals, and then you're gonna have social security.
Right.
Do they get any money to take home?
Right, I understand what you're saying. And that's one of the things that we want to make sure that the contract that we have with PSU ensures that they're sustainable so that they are able to hire employees who are good quality employees, who they're able to pay so that they are good quality employees. And whether, extra training, that kind of stuff, work with PSU to make sure that they have that. And I know that there are employees who are currently employees of the county at PSU who are, our alternative was to say, sorry, we're laying you off and you got to find something else. So I know there are, like I said, there's pros and cons, but I completely understand what you're saying, and we feel for those employees, and we've worked with them as far as, like I said, keeping them informed of different things and offering PERS. Some people will decide not to stay in PERS because it's too expensive. But if you're vested and you've got 20 plus years or 21 years,
Yeah.
you're probably gonna be willing to pay a little extra to get that good retirement. So I am thankful that that is an option for them, but I completely understand what you're talking about.
Because it did not happen to the bus drivers.
Right,
And that's a shame, because some of them had it over 20 years.
right.
That's all I have to say.
Okay. Any other questions? Sure.
I may have missed it, why, I guess you said the federal government said we have to do this. Did they give a reason why? Was it just conflict of interest?
Yes, conflict of interest. What they're saying is that we are writing the plan and we're saying, okay, these are the services that you need and you need to get them from us. They're saying that that's a conflict of interest. Now, clearly we don't make money. I mean, we're not a business that makes money as the county because we do provide the match. So from that perspective, it's a little different than someone else who might not be paying for any of it. But basically they're saying that on paper, if you're writing the plan and you're saying you need these services, and oh, by the way, we're gonna provide those so we can bill Medicaid for them, they're saying that's a conflict.
They just want a private entity.
They want a private entity to provide it, correct? Yep, yep. There weren't any specific issues that came up necessarily to say, you know, this county board did this wrong. It's a countrywide thing. It's all 50 states are gonna have to do that.
Necessarily funding, because they're still going to pay you the 40 and then the.
Right, they're still gonna be billing Medicaid the 60%.
It's just more of a conflict of interest.
Yes, exactly. Yep.
I'd just like to say thank you for not taking the easy route and closing the doors. I'll be the first to say thank you.
You're welcome.
I appreciate it.
Thanks.
Who determined all of a sudden, we gotta change it, there's a conflict of interest, kind of like, it wasn't broke, why fix it?
Yeah, and that's kind of what we said too when this came out. It seems to be working. Some people were private, like I mentioned, that map that had several red counties, they already privatized, it seemed to work for them. We thought it was working fine, but the federal government, I don't know what sparked it at their level, I really don't, but they're the ones that came down with this new regulation in March of 2014 that said, this is a problem that states can't continue to write the plan and provide the service. So it started from them and kind of filtered down from there. Sure. Okay, well, thank you all so much for being here this morning. We'll be around if you have any questions, you want to stop up and see us, but I appreciate you all coming. Again, we do have another one tonight and 2 more next Tuesday, so if you know people who weren't able to be here this morning, we have 3 other opportunities for them. We'll be going over the same PowerPoint, answering questions as well. So thank you all so much for being here today.